the today's session, we are going to discuss the syllabus of the Pharmaceutics I. Simply, I'm going to highlight here the topics which are going to be discussed in the subject Pharmaceutics I. Here it's a disclaimer for all of you. So pharmaceutics, it is the discipline of pharmacy that deals with the process of turning a new chemical entity or old drug into a medication to be used safely and effectively by the patient. It is also called the science of dosage form design. So simply, pharmaceutics, it is the discipline of pharmacy that deals with the process of converting any drug, any chemical entity, any new compound or old drug into the medication which is to be used safely and effectively by the patient, that is known as the pharmaceutics. Simply, we are converting the drug into the suitable dosage form. It is also called as the science of dosage form design. So in Marathi, the pharmaceutics, it is nothing but the औषध निर्माण शास्त्र. So औषध निर्माण शास्त्र ही एक फार्मसीची शाखा आहे जी नवीन रासायनिक पदार्थ किंवा जुन्या औषधांना औषधामध्ये रूपांतरित करते, याचा रुग्णांमध्ये सुरक्षित आणि प्रभावी औषध म्हणून वापर करता येतो. त्याला आपण काय म्हणतो? औषध निर्माण शास्त्र असे म्हणतो. सो याला डोसेज फॉर्म डिझाईनचे विज्ञान असे देखील म्हणतात. इज द discipline of pharmacy that deals with the process of converting the drug molecules into the suitable medication and which is to be safely and effectively used by the patient, and it is also called as science of dosage form design. So this is the basic definition of the pharmaceutics. Let us move towards the scope and objective of the subject pharmaceutics. Course is designed to impart a fundamental knowledge on the preparatory pharmacy with the arts and science of preparing the different conventional dosage forms. So whatever the course is there, that is a subject pharmaceutics, it is designed in a such way to impart the fundamental knowledge on the preparatory pharmacy with the arts and science of preparing the different conventional dosage forms. So this is the specific scope for the subject pharmaceutics. Let us see the objectives. So after completion of this course or after completion of this subject, you will be able to know the history of profession of pharmacy in India. So we are going to discuss the history of pharmacy profession in India. So after completion of this course, you will be able to understand the basics of different dosage forms, then pharmaceutical incompatibilities and pharmaceutical calculations. You will be able to understand professional way of handling the prescription, writing of the prescription, parts of the prescriptions and the handling of the prescription. And furthermore, you will be able to prepare various conventional dosage forms. For example, monophasic dosage forms or biphasic dosage forms or the solid dosage forms or semi-solid dosage forms. So at the end of this course, you will be able to formulate, you will be able to design, you will be able to prepare some of the conventional dosage forms like solid, liquid or the semi-solid. So these are the few objectives of the subject pharmaceutics. Let us move towards the syllabus. There are 5 units are there. Very first unit, we are going to discuss the historical background and development of profession of pharmacy. Here in the historical background, we are going to discuss history of profession of pharmacy in India in relation to pharmacy education. We are going to discuss the pharmaceutical industry and its organization. Then we are going to discuss pharmacy as a career. Then the details of various pharmacopoeias like Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia, and the extra pharmacopoeia. As the pharmacopoeia, or say for example the Indian pharmacopoeia, it is an official publication containing a list of medicinal drugs with their effects and directions for their use, which is published by Ministry of Health and Family Welfare, India. The first Indian pharmacopoeia or first edition of Indian pharmacopoeia, it is published in the 1955, whereas the latest edition, that is the 8th edition, which is published in 2018. So this is the photograph of Indian Pharmacopoeia 2018 volume 1, which is published by Ministry of Health and Family Welfare, India. So in the first unit, first bit, we are going to discuss historical background and development of pharmacy profession. The next point is the dosage form. So here, very first thing, what is mean by the dosage form? So dosage forms are the means by which the drug molecules are delivered to the site of action within the body. Here we are converting the active pharmaceutical ingredient by formulating to the suitable dosage form and which is delivered to the site of action within the body. So the dosage forms are the means by which drug molecules are delivered to the site of action within the body. There are so many types of the dosage forms are there. Maybe the solid like a tablets, liquid like a solutions, or the semi-solid like the ointments. So in this beat, we are going to discuss the introduction to various dosage forms, then classification of dosage forms and their definitions along with the marketed example. The next point is prescription. So what is mean by the prescription? So look at the figure. So this is a prescription. Maybe all of you are aware about the prescription which is written by the physician or the doctor. So the prescription, it is a written order from a registered medical practitioner to the pharmacist to compound and dispense a specific medication for the patient. So in the prescription chapter, we are going to discuss the definition part, then the parts of prescription, handling of prescription, and errors in the prescription. So in the next point of the unit 1, we are going to discuss the postology. So the postology, it is a branch of medical science which deals with the how medicines are dosed to produce its therapeutic effect. It is something related with the dose of the medication that is known as the postology. In the postology bit, we are going to discuss the definition, factors affecting postology, then the pediatric dose calculation based on age, body weight, and body surface area. Moving towards the unit 2, in which we are going to discuss the pharmaceutical calculation. So look at the figure. So these are the weights and measures. Maybe all of you have seen the pharmaceutical calculation bit. We are going to discuss weights and measures, that is a empirical and metric system, then calculations involving the percentage solutions, then the alligation method, preparation of proof spirit, and the isotonic solutions based on a freezing point and the molecular weight. So these are the things which we are going to discuss under the chapter pharmaceutical calculations. The next bit, that is a powder. So the pharmaceutical powders, it is a mixture of finely divided drug and or chemicals in a dry form meant for internal or the external use, that is known as the powders. So powders, it is a mixture of finely divided drug. It comprises the API or a drug or a chemicals in the dry form for the internal or the external use. Internal means which is given by oral route, and external means which is applied externally onto the body. So in the powders chapter, we are going to discuss the definition, then the classification, advantages and disadvantages of powder. Furthermore, we are going to discuss classification of powders, further details of the simple and compound powders, then the certain official preparations which are given in the Indian pharmacopoeia, then dusting powders, effervescent powders, efflorescent powders, and hygroscopic powders and eutectic mixtures. Then preparation of the potent powder by using the geometric dilution method. The next bit in the unit 2, that is the liquid dosage form. So simply the term liquid, it indicates that whatever the formulation is there, whatever the dosage form is there, which is a liquid in nature. So these are the liquid preparations usually consisting of a solution, an emulsion, or a suspension of one or more medicaments in a suitable vehicle, that is known as the liquid dosage forms. For example, the syrups, cup syrups. So cup syrups are categorized under the liquid dosage form. So liquid dosage forms are the liquid preparations usually consisting of the solution or a emulsion or a suspension of one or more medicament. Medicaments means it's a API, active pharmaceutical ingredient, or the drug or a new chemical entity in a suitable vehicle like a aqueous vehicle or a non-aqueous vehicle. So in the liquid dosage form, we are going to discuss the definition, advantages and disadvantages of liquid dosage form, then excipients used in the formulation of liquid dosage form, and the solubility enhancement technique. So these are the things which we are going to discuss under the chapter liquid dosage form. Let us move towards the next bit. That is chapter 3, that is unit 3. First point, that is a monophasic liquid. So itself, look at the term, that is a monophasic. Monophasic means it comprises a single phase, isn't it? That is known as the monophasic liquid dosage forms. So the monophasic liquid dosage form is a liquid preparation containing two or more components in a one phase system or a single phase systems. That is whatever the API, drug, new chemical entity, it is dissolved into the suitable solvent, and thereby we are getting the dosage form which are categorized under the monophasic liquid dosage form. For example, mouthwash or the syrups. So we are going to discuss the definition, then preparation of gargles, mouthwashes, throat paint, ear drops, nasal drops, enemas, syrups, elixirs, liniments, and the lotions. So these many of the dosage form which we are going to cover under the chapter monophasic liquid dosage form. In the biphasic liquid dosage form, we are going to discuss the two dosage forms, one that is a suspension and another that is an emulsion. But before that, you should know what is meant by the biphasic liquid. Itself name suggests that it comprises the two phases. As in the case of suspension, the solids are dispersed into the liquid. In such cases, it is said to be the suspension. If the solids are dissolved state in a given solvent, then it is said to be the solution. So biphasic liquid dosage form is the liquid preparation which consists of the two phases. As in the case of suspension, the solids are dispersed into the suitable liquid. Solid, that is nothing but a active pharmaceutical ingredient or the drug. So in the bit biphasic liquid suspension, we are going to discuss definition, advantages, disadvantages, along with the classification of suspension. Furthermore, we are going to discuss the preparation of suspension, how the suspensions are prepared, formulation of suspension, then the difference between flocculated and deflocculated systems, along with the stability problems and methods to overcome the suspension stability. So these are the major points which we are going to discuss under the chapter suspension. Let us move towards the next bit, that is the emulsion. So emulsion, it is a biphasic system as it comprises the two phases. Both the phases are in a liquid state and one phase it is dispersed into the another phase. So look at the figure here. First one, that is a O by W, that is oil. It is dispersed into the water. So we'll get the O by W type of emulsion. And when the water is dispersed into the oil, we are getting the W by O type of emulsion. And whatever the formulation is there, it is being stabilized by using the emulsifying agent, that is known as the emulsions. So we are going to discuss definition, classification, then the details of the emulsifying agents along with the examples. Furthermore, we are going to deal with the test for the identification of types of emulsion, then the methods of preparation of the emulsion, and stability problems and methods to overcome it. So these are the points which we are going to discuss under the chapter emulsions. Moving towards the unit 4, that is the one of the semi-solid dosage form, that is a suppositories. It is a unit dosage form. So suppositories, look at the figure. It is a dosage form used to deliver the active medicament or medicaments by insertion into the body orifice, where this formulation it is going to be dissolved or melts to exert the local or systemic effect. For example, suppose the suppositories are inserted rectally. So what will happen? Whatever the formulation is there, it is going to be melted into the rectum or it is going to be dissolved along with the API or drug. It is going to be released and it exerts the local action or it gives the systemic effect. That is known as the suppository. So suppository is a dosage form which is used to deliver the medication by insertion into a body orifice, for example rectum, where it dissolves or melts to exert local or a systemic effect. So in this bit we are going to discuss the definition, then types of suppositories, advantages, then disadvantages. Furthermore, we are going to discuss the types of bases which are used to manufacture the suppositories, then different methods of preparations, then calculation of displacement value, furthermore its detailed calculations and the evaluation of the suppositories. So these are the points which we are going to discuss into the chapter suppositories. The next point which we are going to discuss in the chapter unit 4, that is the pharmaceutical incompatibility. It is defined as when two or more ingredients of the prescription are mixed together, the undesired changes that takes place in the physical, chemical or therapeutic properties of the medicament. So in this chapter we are going to discuss the definition of the pharmaceutical incompatibility, then the classification, then physical incompatibility, chemical incompatibility, and therapeutic incompatibility, along with the examples. Moving towards the next unit, that is the semi-solid dosage form. So what is mean by the semi-solid dosage form, which have the which looks like, say for example, semi-solid in nature, isn't it? Maybe all of you are aware about the Zendubam, it is or Amrutanjan, or the some certain creams. All these are the semi-solid dosage forms, isn't it? So semi-solid dosage forms are products of the semi-solid consistency and applied to the skin or a mucous membrane for a therapeutic or a protective action or the cosmetic function, isn't it? For the cosmetic purpose also we are using the semi-solid preparation. Look at the figure. So in this bit, we are going to discuss the definition, classification, mechanisms, and factors influencing the dermal penetration of drugs. Furthermore, we are going to discuss the preparation of ointments, pastes, creams, and gels. Then excipients used in the semi-solid dosage forms and the evaluation of semi-solid dosage forms. So these are the certain points which are covered in the semi-solid dosage form. So this is the syllabus of the Pharmaceutics I, and these are the some of the reference books. I'm saying reference books which I used to study the subject Pharmaceutics I. Very first one, that is Pharmaceutical Dosage Form and Drug Delivery System by the Ansel. Then the second book, that is a Cooper and Guns Dispensing for Pharmaceutical Students by Carter. Then Pharmaceutics, the Science and Dosage Form Design by Alton. Then the Theory and Practice of Industrial Pharmacy by Lashman. Then the Science and the Practice of Pharmacy, that is Remington. And the last book which is to be used to study the Pharmaceutics I, that is the Tutorial Pharmacy by Cooper and Gunn. So there are so many other textbooks are available in the market. So you can choose any of the book, but more preferably you should use the reference books for the reference book to study the subject Pharmaceutics I. Okay, so moving towards the examination and assessment, as you know that it's a total, there are the 100 marks for the examination, and it is divided into the internal assessment and the end semester exams. In the internal assessment, it is for the 25 marks, and end semester exams, that is say the university exams, which is for the 75 marks. Internal assessment, furthermore, these 25 marks are divided into the two parts, that is the continuous mode assessment, that is the 10 marks, and your periodic test exams or the sessional exams, that is the 15 marks. The continuous mode assessment comprises the tutorials, it contains the assignments, it contains the OBTs and or presentations and the group discussion. So it is having the 10 marks along with your attendance. So this is the attendance criteria, mark grading for the attendance. So for the attendance, it is 4 marks are allotted from the CME, that is a continuous mode. Then for academic activities like a quiz, assignment, open book test, field work, group discussion and seminar, then there are the 3 marks which are given from the continuous mode, and student teacher interaction approximately 3 marks are given. So total 10 marks are allotted to the continuous mode assessment, which comprises your attendance, then academic activity and the student teacher interaction. Furthermore, final exams we carried out for the 50 marks, and the end semester examination, it is for the 100 marks.